Hello, this is a training for cardiopulmonary procedures MA104. This course is taught on the clinic side of Module 4. In this course, your students will be required to work in Ross Edge, which is our web-based student success and professional development program. They will be in Section 3 goal setting. If you have not already become familiar with Ross Edge, please make sure that you log onto the program and review this section. Students will also be in the KINS Medical Assisting Fundamentals text in Chapter 28, Cardiopulmonary Procedures. They will be required to perform an electrocardiography, perform spirometry testing, and administer nebulizer treatment, although that proficiency will be strictly role play as we do not administer medications in class. Okay. Students in this course will need to be reminded about modesty as we will be performing EKGs. Students will not be wearing bras during the EKG, as bras are not allowed in the office during this procedure. The bra compresses on the electrodes, which causes artifacts. If you have a student who just cannot be a patient, maybe they've had a mastectomy, they have a medical reason, please work with your AD to handle this situation tactfully, and the student will not be required in that circumstance to be the patient. Okay. Make sure that you are ordering the supplies that you need for this module 2 weeks before the module begins. You will need gowns, you will need drapes, you will need all your EKG equipment. The spirometry test is sometimes difficult for students, so explain to them how important coaching is in performing spirometry to get them to blow hard enough into the machine to get an accurate reading. Students can bring in a large shirt with a button-down opening for electrocardiography instead of wearing a paper gown. Again, making sure that you're showing them how to fold over the shirt to ensure the modesty of the patient. Students will be filling out a proficiency checklist. Here is a proficiency checklist. So they will have 3 attempts to do each one of the procedures. If additional attempts are needed, they most surely are encouraged, but we will not be recording past 3 attempts. Once the attempt has been successfully completed, then the outcome, hopefully a pass, will be recorded on the proficiency checklist. Students will fill out their name and date of completion, and then upload that to their course for proof of proficiency. So let's go ahead and take a look at the assignments for this course. Okay, so they'll have their Ross Edge assignment with that section 3. They'll have a cardiovascular conduction ICA. They'll also have analyzing ECG tracing ICA. This can be a challenging ICA. It's okay if you want to group students together. They are allowed to use their book and any other resource materials to complete their ICAs. They'll have the SIMTICs for performing and interpreting ECG, as well as a nebulizer, and then they'll have another Ross Edge ICA. In addition to that, they will have their 2 row assignments and their test. And most of the time they'll have, and I believe that's the case in here, that they will have multiple attempts to achieve the highest grade. So when students are performing their electrocardiogram ECG, they will be required to do so in under 6 minutes. That would include filling in the patient information. It would also include setting up the patient with the electrodes and running the electrocardiogram out without artifacts. If you have a very large class, you may need to schedule a TA to come in to make sure that you are able to complete all of the proficiencies on time. So please work with your AD if you need a TA in class and get those hours approved. Hopefully this was helpful. If you have any more questions, please make sure that you reach out to me. I'm more than happy to help. Make sure that you're prepared and ready to teach and have fun. This is a very, very exciting module for a lot of students. So with that, thank you and have a good day.